Hello, welcome once again to Moorgate Andrology, and in this morning's video I want to ask the question lots of guys ask here at Moorgate. Can you make your penis bigger? Can you make your penis bigger? You know, at Moorgate Andrology in the last 10 years we've seen a dramatic rise in the number of guys coming along for penis enlargement surgery. This is a procedure which can increase both the length and the thickness of your penis at the same time. So it is possible to make your penis bigger in length and girth. Now, I would say about 90% of our patients who come for penis enlargement will choose to have their penis made longer and thicker at the same time. They're looking for as much increase as is possible. Of the ones that don't have both, then the other 10% will have the penis girth made bigger. Most guys, if not all guys, want to see an increase in their penis girth. Now, the way that the lengthening part works is based on the principle that as men, we all have extra length in our penis that we don't realize we have. And this is because this length is hidden. It's held back by a ligament called a suspensory ligament. And this ligament is deep in the structure of the body. It lies under the pubic bone. And its only function is to keep the penis upright when it's erect. That's all it does. And when this ligament is divided, it slides the penis forward and reveals this hidden length. Now, the results of this procedure are quite predictable. We know that in 95% of cases, guys will get an extra 1 to 2 inches more in the flaccid length. Yeah, that's right, the flaccid length. This procedure does not increase erect length of your penis, just the flaccid length. Erect length is something that we work on after the surgery by use of a traction device that produces some growth factors in the penis to increase the erect length over time after the surgery. And that's a device that we give patients at about 6 weeks after their surgery when everything is settled down. Now, as well as lengthening, as I said, we can thicken your penis. For that, we use the gold standard procedure to increase penis girth, and that is a fat transfer. And we do a fat transfer because this procedure is permanent. You will get some initial absorption of the fat after it's been transferred, about 30% actually, but the remaining fat will stay, provided that you don't lose a significant amount of weight. You will have that fat that we transferred. Now, this fat is taken usually from your stomach in a small liposuction, and this fat is then purified. We take out unwanted material like blood and oils from the fat before it's re-injected into the penis. And if you imagine a clock face, then it's injected round from 7 o'clock to 5 o'clock, but not 5 o'clock to 7 o'clock. Because underneath the penis is where the main water pipe is, and the fat isn't put there. So, how much can we increase the girth by? Well, in most cases, then you will see an increase of at least 20% in the mid-shaft. It doesn't sound a lot, but it is a lot in terms of volume. And normally, you will achieve at least an inch thicker in both the flaccid and the erect state of the penis. So when the procedure is finished, your flaccid penis will be nearly double the size that it is now. And as I say, after 6 weeks, we start you on this traction device to help increase the erect length. Now, all this is done in one procedure, and it takes about 1 hour, that's all, under general anesthetic. You're asleep when you have it done. And following a short recovery, you can go home later the same day. Now, if you have a sedentary job, it's not a physical heavy lifting job, then normally you'll be back at work after 2 to 3 days. If you have something a bit more physical, you may want to take a few days more. When you've had penis enlargement surgery, you cannot have sex for 6 weeks. You need time just to settle down. And then you have the results, hopefully, that you wanted. So again, just to recap on those results: lengthening, an extra 1 to 2 inches in the flaccid length; girth, an extra 1 to 2 inches flaccid and erect. So I hope that's given you some idea and answered the question, can you make your penis bigger? You certainly can. If you want to know more about penis enlargement surgery, please do get in touch with us here at Moorgate Andrology, and we can arrange a consultation for you with one of our urologists. So that's all from me today. I look forward to seeing you back here at Moorgate very soon. And until then, bye for now.